All right, hello everyone, and welcome to our second conversations on brain health. My name is Augusto Mirabade. I am a neurologist at Rush. Someone ask any questions? Go. That's a question. But anyway, it's my pleasure uh, the co-chair for this series and someone that perhaps doesn't need an introduction, but just in case you have not met Adrienne Castillo, she's a nurse practitioner at Rush. She's been at Rush for many, many years, and I'm going to let her actually answer that question. Adrienne has a special interest in brain health. She specializes in multiple sclerosis, and she's also a certified lifestyle coach. So, Adrienne, welcome.
Thank you, and thank you for having me. I'm very happy to be here.
Excellent. And please answer that question. How many years have you been with Rush?
Over 35 years.
Over,
So
over 35 years.
I spent my first 20 years in inpatient neuro and then was recruited to the MS Center in 2010, where I was an infusion nurse for a few years, became manager, clinical nurse manager. And in 2018, I graduated with my master's. In 2019, I became board certified as a family nurse practitioner. And that's truly when my journey began. I was very interested in a wellness approach to MS. And so I did a lot of research and found all sorts of exciting information, and my creative juices started flowing, and I said, I figured out a way to bring this to the clinic. And so that's where we're at today.
That is excellent. And I have to tell a story. When I came to Rush for interview, that was last December. I had a wonderful day. I met with many people. Of course, I met with Dr. Stefowski, a person that I admire. And then the last person of the day was Adrienne Castillo. And I was already very happy before I met Adrienne, but I have to say that after meeting you, that solidified my impression of coming to Rush. It was immediate. We were talking about brain health and the importance of all of these things that we're going to talk today and in this next series. And we pretty much will, uh, finishing each other's sentence, right? So it was something that the connection was immediate, the alignment in this shared vision of kind of building on what we are learning from research, from studies on the importance of lifestyle interventions in MS. And finally, we are starting to have the evidence that will allow us to build programs around this. So without further ado, let me just start with some important topics. We're going to have two sections in today's presentation. One is going to be about neuroplasticity. I'm going to explain what that means and how we can measure that. And then at the end, Adrienne is going to walk us through the Brain Health Clinic and how we can apply some of these principles into our patients' lives. So what is neuroplasticity? This is the actual definition, which is the ability of the nervous system to change its activity in response to intrinsic or extrinsic stimuli by reorganizing its structure, functions, or connections. So basically what that means is the central nervous system is very flexible, is very dynamic. It's going to change and adapt. And that change and adaptation is in response to things that we do, but also things that happen to us. And there are certain things we can control. For example, what we eat, what we do with our brain, the things we do with our cognitive activities. There are things we cannot control, like how old we are and the process of aging, but we can influence how we age. This concept of biological age is something that could be influenced. So, and this concept of neuroplasticity or change or adaptation could be beneficial, and that's what we're going to talk today. So things we can do to improve the function of the brain, but also could be neutral, meaning things change but nothing improves or nothing gets worse. Or unfortunately, sometimes this process of adaptation leads to pathological states or negative consequences. And perhaps the easiest one to understand is if, let's say, someone with multiple sclerosis develop a lesion, and that lesion leads to weakness, let's say on the right leg, and if that person doesn't move or stimulate that leg, over time, the leg could become weaker because there is, on top of the weakness that came from that lesion, there's also the weakness that occurs in the rest of the muscles from not using that limb. So there is this negative adaptation that happens as a consequence of a lesion. So I'm going to explain this in a way that perhaps is easy for all of us to understand. And those of you who know me, I like these analogies because it's kind of like my way to get my head around these complex topics. So let's imagine that the brain and the neurons in the brain, the cells in the brain, are equivalent to employees in a law firm. And we have a law firm that had 300 employees, and due to COVID-19 pandemic, had to reduce their workforce. So that will be equivalent of a brain has billions of neurons, and due to multiple sclerosis, whether it's due to the lesions or perhaps due to atrophy, those neurons are decreased. So that will be a situation in which you lead to less neurons or less employees. So what will be a natural consequence or adaptation to that situation? Well, one will be, okay, let's create new employees. Let's create more employees, right? And in the real world, that's happening with companies when they're decreasing their workforce. They implement things like artificial intelligence, right? They create ways in which you can improve productivity with less workforce. So in the brain, that's called neurogenesis. So that will be, let's create new neurons. And I believe there were a couple of questions that the audience sent before asking, can the brain create new neurons? And if you are in my age group or older, perhaps you learned that probably not. When I went to med school, we were taught no, the brain has a fixed number of neurons, and you're born with those numbers, and that will never change. And then we learned that that's not necessarily true. And these studies started in animals, in rats, in mice, and then they went to mammals, and sheep, and monkeys, and lately in humans. And what we are learning from these research studies is that indeed there are a subset of neurons, not all the neurons in the brain, but there's a group of neurons that actually can regenerate, and we can create new neurons, something called neurogenesis, particularly in few areas. One is called the hippocampus. So the hippocampus is that part of the temporal lobe that has a direct relationship with memories. So every time we create new memories, this process of memory acquisition could lead to neurogenesis. But also, what we are learning is that there is a lot of things we can do to enhance intrinsic adult neurogenesis. And perhaps by now you know that we are very strong advocates of exercise. And exercise is one of those areas that has been linked to enhanced neurogenesis in the hippocampus, positively influencing memory and learning. Also, there are certain neurotransmitters that modulate mood regulation, particularly dopamine, serotonin, and norepinephrine. Those neurotransmitters are directly influenced by the use of exercise. And that's why now there are many research studies. Few of them are actively enrolling patients. And I have the information for you at the end of the presentation. If you're interested in participating, there are studies done at UIC next door to us, and we can enroll you in our clinic in the use of exercise for the treatment of depression. We also know that exercise will enhance brain plasticity that is critical for recovery from injury, in this case, multiple sclerosis, but also a plasticity that is helpful for aging. So basically, even though there are certain ways in the laboratory that researchers can enhance neurogenesis, there are different ways we can enhance neurogenesis now without the need of any pharmacological interventions, which is with the use of exercise. So, but let's go back to the law firm and let's imagine that, okay, we decrease the workforce and what else can happen besides creating new employees? Well, one of the common strategies that people do if you have less employees is let's try to improve communication. Let's try to make the workflow more efficient. Well, the brain does the same thing in the context of, let's say, decrease amount of neurons or lesions or atrophy. The brain is going to reorganize itself in a way that becomes more efficient. There is a scientific term for that called synaptic plasticity. And what is that? Well, let's imagine that a neuron is like this figure here. Can you see my arrow? I'm moving on the screen. Copy again.
Yep.
Okay, so this is the body of the neuron, and this is the axon, and this is the dendrites. So the way the neurons communicate is by the connections between the dendrites and the other neuron. So if there is a lesion or injury in the brain, that connection is going to be interrupted. And that often happens in, let's say, in multiple sclerosis. So there are two mechanisms for compensation to that. One is what we call regeneration or repair. And there were a lot of questions about myelin repair and regeneration. And what I decided to do is include that topic in our next series in January 9th. So stay tuned because we are going to talk about remyelination and repair. So that way the brain can try to enhance remyelination and repair, and there are intrinsic ways by which the brain can do that. Of course, the younger we are, the more efficient those mechanisms are. But another way to compensate for injury will be something called sprouting or axonal sprouting. And that is similar to how plants sprouts. And you have a neuron here, and the neuron was supposed to just communicate with one other neuron. And in the context of this injury, is going to create another arm and communicate with a neighboring neuron. How can we enhance this concept of sprouting or axonal sprouting? Well, guess what? Exercise again. So synaptic plasticity going to be positively influenced by exercise, something that again we continue to learn, but also repetition of tasks. So whether it's physical activity or cognitive activity, when we do something multiple times, we are challenging the system to actually become more efficient. And one of the mechanisms by which the brain becomes more efficient is by this compensatory sprouting. And I think we all can attest to that. If you learn how to bike when you were a kid, in my case, I learned how to bike when I was older, which is kind of embarrassing, but most people do that when they're kids, right? And so you probably struggle the first couple of times, and then you have to do it multiple times and fall and fail until you got it right. Well, you are probably doing this compensatory sprouting constantly in creating these systems that you want to challenge more efficient. But also there is something about motivation. And that's why it's so critical to look at things like depression in multiple sclerosis, because it's so difficult to do any of the things that we're going to talk to in this series if you have depression. Why is that? Because you're lacking motivation, that energy to actually do things, the driver to allow you to do things. But we also know that there is a biological reason behind that. Uh, Lower levels of a neurotransmitter called dopamine are directly related to this motivation or energy that we have in the brain. So studies have shown that decreased levels of dopamine will negatively influence this compensatory sprouting. So I hope I'm not going too fast, and please ask questions if you have questions or if you need me to clarify some of these topics, as this is very complex. I'm trying to make it as simple as possible, but these are complex topics. So let's go to another example. So we talked about creating new employees or neurogenesis. We talked about improving communication or synaptic plasticity or axonal sprouting. Let's now talk about another mechanism by which the brain can compensate in the context of injury. And is what companies love doing, called reorganization or retraining. So, okay, we went from 300 employees to 100. We're going to retrain you to play not multiple roles. You were hired to play one role, and guess what? Now you have to play 5 different roles. So this is something that happens all over. And of course, the brain does the same thing, and it's something called functional recovery, which is neurons that perhaps were there to support, or they were there without any particular function. All of a sudden, they have to adapt to this new environment and assume a new function and assume a new role. So, and how is that working? Well, we know that both motor rehabilitation as well as cognitive rehabilitation is possible in multiple sclerosis. And we can measure that by something called functional MRI. So what you see here is a series of MRIs of a patient with multiple sclerosis. And this patient was asked to do a motor task. In this case, was tapping both feet. So the patient was inside the MRI and were asked to tap the feet on the ground. And you can see the areas of cortical activation are represented here with orange and yellow. So one of the things you see is that there is a lot of activation of many areas of the brain by just simply doing that motor task. So after they measure this, they ask this patient to go through a series of physical training, endurance training, physical therapy for 2 months. And then at the end of those 2 months, they did the same study. And what did they find? Well, they found that there is indeed less cortical activation. So you can see if you particularly go to the third row, that the areas, this is the same patient, the only thing that changed was 2 months of physical therapy. You can see that the third row, for example, there is significantly less activation of the brain, which that tells us that the brain became more efficient. The brain didn't need to activate so many areas to perform that simple task. And this is something that happens with or without MS. There are wonderful studies looking at, for example, professional musicians versus amateur musicians. And when you look at a professional pianist play the piano or pretend to play the piano inside an MRI, it only uses a small proportion of the brain, whereas you see an amateur pianist trying to do the same movement and is going to use the entire brain. And the reason being, the more proficient you are in something, or the better trained you are in doing some task, the less cortical activation you need. Talking about music. So if you don't know that, I have a passion for music, and I wanted to be a pianist and musician, and then I realized that it was too difficult, too hard, and I decided not to do that. But I still have this passion for music, and every chance I have to go to a concert, I'll do. And I have to say that one of the influences that my wife did in my life is introduce me to not classical music, pop music. And I have to say, I like it too. I enjoy any type of music and all types of music. But what is music doing to our brain? Well, music is a workout for the brain. Music will cause both structural and functional changes in the brain. It's a way to promote neuroplasticity. And you know, when you start looking at things like direct effects of music in neurological disorders, this was studied in stroke, for example, studied very widely in Parkinson's disease, and most recently multiple sclerosis. And what we are learning from that is that music can activate or modulate the signaling of certain parts of the brain that are involved with emotional processing, cognitive flexibility, attention, reward, and motivation. I like this slide because it just gives us the sense of that music affects pretty much every part of the brain. It's like an entire workout for the brain. But what I want to draw your attention is this concept of the auditory cortex, and that's also in the temporal lobes, in the prefrontal cortex, which that has a direct effect on cognition. And also in the corpus callosum, there in blue, is a bridge in between both hemispheres that is primarily affected by multiple sclerosis. And we know that musicians, for example, have larger interhemispheric communication, larger corpus callosum. So if you enjoy music, that's great, but if you play music, it's even better. So that's something that no matter whether you just listen or you perform, you're going to get a benefit. I believe there was a question, and I will address that in the next slide. So listening to music also reduces the chronic stress hormone called cortisol. And perhaps Adrian can mention that because she worked in many areas in the ICU as well. And there were studies looking at, for example, patients in coma and you look at with or without music, and those individuals with music has decreased levels of blood pressure, the heart rate went down. So there is a direct effect that music has in our stress hormones. We were talking about dopamine before. Dopamine is a motivation molecule. And I challenge you to go to YouTube and search for music therapy and Parkinson's disease. And you're going to see multiple videos of patients with Parkinson's disease, which they lack dopamine. And when they're exposed to music, they can actually walk better and they can walk faster. So there is a direct and very fast, rapid effect on dopamine and music in the brain. But also playing music with others or going to a concert with others stimulates another hormone called oxytocin. That's also known as the cuddle hormone or the love drug. And I think we all can attest to that. Is, going to a concert is great, but going alone is not so good. If you can share that with someone, it actually enhances the experience. So answering the question that someone had, does music type matter? I wish I could tell you yes, because I'm a big fan of classical music, but I did know the so-called Mozart effect that we learned in the 90s and early 2000s. It's not true. In the past, we used to think that certain types of music were better for the brain, and the answer is no. The key here is that it's something you enjoy, something that is going to stimulate you, challenge you, and hopefully help you. And the other thing that I found interesting is that even though different cultures may experience music in different levels, whether it's cultures in Africa or in South America or in Asia, they may have music play a different role in their lives. Our brain responses to music is very consistent, regardless of the type of music or regardless of the culture that we belong to. And if you want to read more about this, I have a couple of articles here that I listed. One is mindfulness and meditation and the relationship with long-lasting changes in the hippocampal function. And this was a study looking at brains in patients that were exposed to mindfulness and meditation, and they measure brain activity with the use of magnetoencephalography, which is a way to actually see how the activity of the brain is. Um, and then music training and neuroplasticity and cognition. That's another example of another study that actually was done. But now there are many studies looking at the use of music therapy in the 3-week brain health program that we offer through the Brain Health Center of the Rockies. And now we're going to be offering through Rush. So we have an entire session on music therapy. And we have a music therapist from Colorado State University that actually gives you an example of how, for example, you can build playlists and use the rhythm in the music to kind of accomplish a goal. So let's say you want to use music to improve motivation or to give you energy to fight fatigue. Let's say today you want to clean the house and you're tired. Well, you can create your own playlist that is going to walk you through where you are and bring you where you want to be by changing the rhythm and the pace of the music. Alternatively, you may want to use music to relax. If you're having a bad day, you have a lot of anxiety, you want to use music. Well, if you have anxiety and your level is here, if you put music that is very slow and peaceful, it might not feel natural. So you have to gradually walk you through the different pace and rhythm of music to get you where you want to be. It's something called entrainment, and it's a principle that actually music therapists know very well. So before I pass this on to Adrian, I want to talk about stress because there were a couple of questions about that. And I think this is important when we approach brain health. And of course, when you work with Adrian in the clinic to understand where you are and where you want to be. And this is a model that actually talks about our comfort zone. And I think we're all familiar with that. So when you're used to doing something, whether it's physical or cognitive or at work, I mean, you're in your comfort zone and your demands are way less than your resources. You have way more resources than what you're being asked to do. And if you stay too much in that comfort zone, you probably are not going to learn too much. You're probably not going to enhance plasticity as much. You kind of stay very neutral. You go to the outside of the circle in the stress zone. Well, that's the toxic stress, right? So, and I think we all can relate to that. Perhaps we all had experiences in that stress level. The demands are being asked on you are significantly higher than the resources that you have, or the time, or the skill set, or the resources. And if you spend too much time in that stress zone, then of course you're not going to learn. You're going to have negative plasticity. So the key here is finding a way in which you are in the middle circle called the stretch zone. And that stretch zone is an area in which you're outside of your comfort zone, but somehow the resources are expanding, or you feel supported, you feel challenged, but you feel supported. And that's when you truly get the most out of learning and plasticity. Just to give an example that is more practical, if you like to work out and you do the same routine every day, well, probably at some point you're going to be in that comfort zone. And if you keep doing the same thing over and over and over, you may not get all the benefits you expect. However, if you go from that routine to trying to run a marathon, you're going to go to your stress zone very quickly. So the key here is to try to listen to your body and perhaps work with someone that is an expert in whatever area you're trying to accomplish and get you in slow increments, but gradual increments outside of that comfort zone. So with that, it's my pleasure now to pass the baton to Adrian. Adrian, I believe you're muted.
Okay, can you hear me now?
Now we can hear you, and I will be advancing your slides.
Okay, I'll let you know when. So I made a mistake of signing into my computer in my office at Rush, which is alongside the L. So and of course it's rush hour. So if I hear a train coming, I might pause for a few seconds, and I'm sorry about that. So I hope everyone is doing well at this time in the conversation. And what I want to talk to you about today is improving health with lifestyle medicine. So let's talk about the elephant in the room. And here comes a train. You know you're in Chicago when. Okay, so psychologists know there are two systems in the brain, the rational and the emotional system. So in this picture, the human writer represents the rational system, so problem solving. The elephant represents the emotional system, or the power of the journey. If these two systems disagree, who would you bet on to win? So it's this power imbalance between the two systems that make adapting new behaviors very difficult. Also, we have to think about the path, removing any obstacles along the way. Lifestyle change is a journey, and it is a long-term journey. It involves a partnership between patients and practitioners, where the writer gets directed and motivated until we shape the path of your wellness journey. Now you can change it, Dr. Mirabali. Okay, so tonight we're going to define lifestyle medicine. identify the 6 pillars of lifestyle medicine, and describe a typical brain health clinic visit with me at the Rush MS Center. So you can advance it. What is lifestyle medicine? Lifestyle medicine uses therapeutic and evidence-based lifestyle interventions to help manage chronic conditions. Lifestyle medicine clinicians prescribe lifestyle change. So you'll go home with a prescription to exercise, meditate, have a meatless Monday, take a 30-minute nap, or eat a predominantly plant-based diet. Lifestyle medicine is a complement to conventional medical approaches such as pharmaceutical treatment. And lifestyle medicine uses coaching conversations that help patients help themselves and focuses on what is working well. You can advance the slide. So taking a proactive approach to maintaining your neurological reserve is a key part of what the Rush Brain Health Program is all about. Disease-modifying therapies are the most effective way to reduce the number of flare-ups or relapses that you have. But leading a healthy lifestyle is really important in the management of MS. And the combination of the two approaches is what will give you the best outcomes. The choices you make can help slow disease progression, and taking good care of yourself can lessen your symptoms and improve your quality of life. You can advance. So what does a typical brain health visit at the Rush MS Center look like? They could be virtual or in-person visits. So I originally had visits at 30 minutes, and I'm finding that they take double that. So I'm telling you 60 minutes. And when you return, perhaps that could be a 30-minute, but definitely initially it's a 60-minute visit. So it's during this time that I'm going to perform a lifestyle assessment. And what that consists of is about 14 questions. We focus on the 6 pillars of lifestyle medicine: exercise, nutrition, sleep, stress management, substance use, and social connection. By the end of the visit, we're partnered, and together we make an individualized treatment plan that includes goals and lifestyle changes. You can advance. So let's take a poll using the guidelines for the 6 pillars of lifestyle medicine to see if you should schedule with me. Raise your hand or stand if you want. Get some activity since you've been sitting for a while. If you've been accumulating 150 minutes per week of moderately intense exercise, which means you're breaking a light sweat. Raise your hand or stand if you are consuming 5 servings of vegetables or more per day. Stand or raise your hand if you are sleeping 7 to 9 hours per night. And this is restorative sleep. Stand or raise your hand if you have a go-to stress resiliency technique that you can use when something very stressful happens. Stand or raise your hand if you are connected to someone who strengthens and supports you. Stand or raise your hand if you are the person who strengthens and supports someone. purpose in life is very important. Women, stand or raise your hand if you are consuming no more than 1 drink per day. Men, stand or raise your hand if you are consuming no more than 2 drinks per day. And then stand or raise your hand if you do not smoke cigarettes. Okay, you can advance. So how did everyone do? Whether you met none of the guidelines, 1, 2, or all of the guidelines for the 6 pillars of lifestyle medicine, I recommend that you make an appointment with me for a brain health visit at the Rush MS Center. There's a couple of different ways to do that. You can call the main number to the Rush MS Center and leave a message for Adrian Castillo stating that you would like a brain health clinic appointment. One of my fans is on this webinar, and I thank you so much. She just said Adrian is great. Or you can call Adrian direct at 312-563-4248. That is my number. I probably won't answer because I'm in and out of my office all day. You can leave a message and I will call you back, and I do schedule my own appointments. Right now, my schedule is pretty flexible, and I can work with you to determine what your needs are for scheduling. And that concludes my portion, and I really thank you for your undivided attention, and I hope to see you soon.
Well, thank you, Adrian. And it's, every time I listen to you talk, I keep thinking, how can we ever clone Adrian? So we have multiple versions of you across the United States in different MS centers, because that's exactly what we need. I was so excited to see that, your passion for this cause is something that we can work and we can capitalize in a sense that we can hopefully help our patients in the best possible way. So thank you for what you do, and for what you started here is actually amazing. So
I think I just got a phone call. Maybe it was someone wanting to schedule. I promise I'll call you back.
that is excellent. So I'm trying to find the questions. Um, So I see some questions about the specific type of music. I believe we answered that already. Is the volume of music plays a role? So of course, it has to be something that is not going to hurt you, right? So try not to make it loud, and nobody enjoys that, but actually no. And there were studies looking at those, for example, how much music is too little or too much. And it's all over the place, as you can imagine, but the recommendation is something around 30 hours per week. And if you start looking at, how much music you already listen to, probably you are meeting that. But it's an interesting thing to do. For example, if you go for a walk, have your headphones, listen to music. As I said before, you can work with your playlists and try to, as you start exercising, start with a slow pace music, and as you continue to build up the sweat, as Adrian was mentioning, the music can actually follow you and track you. So that's something that you can actually start working on that now. So there are questions about groups. So we are not currently offering anything group-based, but we are hoping that these sessions that we offer every month will be linked to 1 or 2 live events per year. And we are thinking about something perhaps in the spring that we can all get together in a space and do a similar concept of what we do with a nonprofit, a brain health fair, in which we have a mix of education, but also screening, perhaps something fun with, nutritional interventions and so on and so forth. So stay tuned. We are hoping to grow these offerings to go beyond webinars and actually incorporate some live events as well.
Dr. Miravalle, I had one question come to me, I think privately, rather than to all of the panelists, about the effective level of exercise patients should be aiming for, how intensive exercise they should be aiming for each week and how much they should?
Right. And that's an excellent question. And now we have guidelines for that, and those are specific to multiple sclerosis. And those guidelines have been established based on the level of disability. So the first step will be to do an actual exam and establish what level of disability you have. So because the goals for the exercise will be linked to that. And so what I usually recommend is work with a physical therapist or again, work with us and we'll be happy to help you. In general, as Adrian mentioned, the current guidelines states that for anyone with minimal or no disability, they should be around 150 minutes per week. And that should be something that is a balance between aerobic or cardio exercise, as well as strength training exercise, particularly for core balance. So things like yoga and Pilates, but these are generic terms. But ideally, and that's what we're hoping to incorporate in the clinic, is a more of a personalized recommendation of exercise.
There's one additional question in the Q&A section. Would medications such as Adderall help with building compensatory sprouting due to the dopamine effects?
Yeah, it's an interesting question. So as you probably know by now, I'm not a big fan of psychostimulants. And the reason being, they provide a transient benefit. If someone has fatigue in multiple sclerosis, we know that there are different reasons for it, but the number one is that the brain is overcompensating by these areas of demyelinations by using more reserve. So there's going to come a point in which the brain is tired and fatigued. So if you are overcompensating and you're exhausting the system, and if you put a psychostimulant to that, you continue to add more stress. So even though in the short term, it might give you that extra energy, in the long run, if the only strategy that you do to treat fatigue is a psychostimulant, is not beneficial. For that reason, it's important to do, well, if you need a psychostimulant, it's fine, but let's make sure that we look into your sleep. Sometimes taking naps during the day helps. When you take a nap, you're kind of like helping the brain to give a break or go for a short walk. Look at other ways in which you can actually build that brain reserve again. Otherwise, it could become a cycle in which is hard to break if the only treatment that we do for fatigue is a psychostimulant.
There are a few questions about just logistical questions of visiting with Adrian after she put her information out there for the clinic. So Adrian, it's okay if everyone reaches out to you directly? Oh,
You're muted.
Yes.
perfect.
I have some personal assistants. Don't worry.
Ooh.
I'm a comedian if you haven't figured it out yet.
There's another question about structured diet for nutritional improvement and specifically speaking about the MIND diet recommendations, if you want to speak to that at all.
I can tell you, I do have specific eating plans for the MIND diet that it'll give you 7 days worth of suggestions for breakfast, lunch, dinner, snacks. Part of a visit could be discussing something like this, foods to eat in the MIND diet and foods to avoid. So feel free to make an appointment with me where we can go over very specific information regarding the MIND diet.
And I believe there were questions about insurance and so on and so forth. So this is considered a visit to any visit to a healthcare provider. So this will be built to your insurance. So hopefully you don't have any issues in terms of access. But we are all about our patients. So if you want to participate and you have any issues, please contact Adrian as well, and we'll try to make it happen for you.
Adrian, would you mind just restating your phone number quickly for the group?
My direct number is 312-563-4248.
And for Susan, yes, so this is integrated into the MS Rush Brain Health Clinic. So the Brain Health Clinic is part of the Rush MS Center. So if you see any provider in the Rush MS Center, you have access to this clinic. Part of the Brain Health Center includes also educational offerings. We have these monthly webinars, but also we have, in case you want more of a condensed curriculum on brain health, we have a 3-week brain health program. In those 3 weeks, we offer small group sessions. Those small groups are 6 live sessions on Zoom, and we also have a library of videos that we will be sharing with you. So if you want to participate in the 3-week brain health program, also let us know, and we can enroll you. I believe the next one is in January and February. So for now, we are still offering that through the nonprofit that my wife and I, we have called the Brain Health Center of the Rockies. We are bringing those to Rush. So we are in the transition period. So for now, you can either sign up on our website in the nonprofit, or also let Adrian know, and she will communicate with us to enroll in the program. If you want to do the website, is www.brainhealthcr.org. So again, www.brainhealthcr, that stands for Brain Health Center of the Rockies, .org. And when you go to that website, you go to the MS section, and then you're going to have the registration. So you can do that way. You can also communicate with Adrian, and we'll internally arrange to enroll you into the program. So I'm going to repeat the website again. It's www.brainhealthcr, altogether, brainhealthcr.org.
I will be sending out a follow-up email after the conclusion of the session, and I'll include both Adrian's number as well as the website in it. How about that?
That sounds great. Thank you, Katie.
Yeah, no
And
problem.
we also want your opinion, your feedback. If you have ideas on topics, I know that you had some questions that were asked before this session. I was taking note on those questions. And then based on that feedback, we will be including remyelination and repair into our next session. So the next webinar is going to be Tuesday, January 9th at 6 p.m. Central Time. And we're going to be talking about remyelination and repair. And also we're going to talk about setting up New Year's resolution. How can we help you be successful in setting up your goals for 2024? So stay tuned. That's going to be a session, again, a little bit of science. We try to kind of mix it up. So with some science and also some practical ways in which you can actually apply these concepts in your life. So that's going to be January 9th. It's a Tuesday at 6 p.m. And I believe we are a few minutes early, Adrian. Anything else?
Here's a question I see. Do you know Trevor Wicken from the MS Gym? He's in Colorado.
I don't, but I'm going to search him up. Maybe I do know him. Yeah.
There's, sorry. I was going to say there's one other question that came through in the Q&A section about minutes of exercise for individuals with no mobility that are in wheelchairs. Is that the same criteria that was discussed earlier?
Yeah, so in terms of time amount is similar. In terms of a type of activities is not. So what I will do, Katie, is I'm going to send you an article that you can share with the group that has all of the different type of exercise per level of disability. If patients want to just read it alone, or if you would like, we can always refer you to a physical therapist, and then they will get to personalize a plan of exercise for you, depending on your needs. But I'll be happy to share that article, which are the guidelines, recently published guidelines for exercise in multiple sclerosis.
Great. I'll make sure to get that out to everybody. I think those are all the questions, unless anyone has some last minute ones they want to submit in the chat really quick.
Excellent. Well, I'm all for efficiency, right? We were talking about efficiency in the brain, so I like this. So as I said before, Adrian, thank you for all you do. Thank you for being here. And
Thank you.
we are all here for you. So if you have questions or ideas or anything you want us to include in these webinars, please let us know. And stay tuned and have a wonderful holiday season.
Thank you, everyone.
Thank you, everybody.
Happy holidays.